When we think about drug dispensing and drug diversion, it might help, Alex, if you just kind of run through the terms, what they mean, and then just anything you can help about the scale of the diversion problem that we have here in the States.
I grew up professionally within a large health system. Health systems and fancy hospitals, they have all the fancy technology. Outside of the hospital system, however, you're like traveling back in time. So the problem that we're solving, we're providing digital medication security and management at the point of care. So the point of care, what I mean by that, you can think of it as a surgery center that's out in the community, a dentist office, a clinic, imaging center, a veterinary's office. There's so many different areas where medications are housed and administered to a patient that are outside the hospital that don't have the hospital technology or budget.
Okay, so is this a little bit like if I go to rob a bank, like I know there's a vault, there's security, there's cameras, but if I want to go to like an ATM, there's probably a little bit less security. It's a little bit easier to, well, maybe not ATMs, but you know what I mean? Essentially, if you're out in the field, the fences are lower.
Yes. So I guess if you went to a bank that's inside of a grocery store and try to rob that, maybe that's a good comparison.
Do they have banks inside of grocery stores?
They do in the Midwest.
Okay, there you go.
That's a great spot. In a little community, you got everything in one place.
I think that's because it's so cold there, you don't want to go outside and change venue. And I recall that from my Chicago time.
Yes.
Okay, so we're talking about surgical centers, dentist office. These are all around the country. And because they do need to deal with controlled substances, even addictive substances, they need to keep them safe. So if I did not have access to a MedServe cabinet, what is the standard legacy solution that you guys are going after?
You're not going to believe me. So these facilities literally use like a kitchen cabinet that has a lock on it, or two locks. Somebody has the keys on them. So sometimes one of the stories we hear all the time is people go to lunch with the key. People leave the office with the key, and then they can't access narcotics because they left. Some people will use a metal, like little more secure metal box with a key, but the key problem remains the same. Many facilities will also invest in the little like realtor key holding box that's on the wall. It's got the little pin code you can put in, but the pin code's shared. When somebody quits, nobody replaces it. They should replace it and reset it, but it doesn't happen. So they're opening themselves up to so much risk by doing this really old school process. Now, this is just the physical storage of the medication. Now, there's also a documentation component. The documentation component, I don't know if anybody remembers the prescriptions handwritten by a doctor, imagine those scribbles in a bigger hurry done by an anesthesiologist on the paper log where they're just jotting down how much they administered to who and trying to make sense of that. And people forget how to do math. People make mistakes, forget to enter data. And a poor nurse or a director of nursing or a manager at the end of the day has to sit there and try to figure out the numbers and why they don't add up.
Matt, so if the numbers don't add up, does that automatically ring an alarm bell? And if so, how shrill is that signal?
Well, it's alarming because unfortunately, drug diversion or drug theft, and yes, Alex, you're welcome there. It really is a growing problem in healthcare. Unfortunately, healthcare providers, about 7% have self-reported that they struggle with substance abuse issues. We unfortunately see horror stories of healthcare providers diverting or stealing drugs intended for patients going through healthcare procedures without proper anesthesia. And when this happens, it often, it has to be reported to the DEA. The DEA is the reason why, we exist in a lot of ways, is we're helping, with the compliance, automate that workflow, secure narcotics to their standards. So all these facilities, when drugs go missing, it is a very alarming.
And then just to add a little bit to it. So it's alarming in a number of ways. One is you're short a controlled substance that you are responsible for.
So the center that is theoretically dispensing holds the bolus of responsibility.
Yes.
Okay.
So it's the center, it's the person in charge of the center. So let's say the administrator, and it's the physician whose name is on the license, the DEA license, who's really got the most to bear. So if there are issues, let's say this is negligence, there's not great policies in place, procedures aren't being enforced, the facility can be shut down, they can have their license suspended, so they can basically be put out of business. And that's without having horrible headlines like Matt was mentioning.